everyone, Sarah Strackhouse here with Real News Communications Network, and of course we're here with our Live with Dr. J. How are you, Dr. Johnson?
Excellent.
Good, good. How was your weekend? Hopefully allergy-free, and your week so far?
Well, when the wind picks up, there's always allergies out there. So we got spring allergies that's coming through. I think mountain cedar's about over with.
Oh, good. That's good news.
So that's good. Yeah. But then we have the grass and the trees, and of course everybody's car has been covered with the oak pollen.
And you know, we've been talking about allergies and kind of some of the issues that people have with allergies, especially not knowing what they are. So today, tell us a little bit about what we're doing and so the different types of ways to do what we're doing.
Well, today we're going to demonstrate allergy testing.
Okay.
And we're going to use an intradermal type of allergy testing,
okay,
which is the most sensitive type. There's other types. A lot of times you'll have prick testing, which they'll use a multi-test, where it's a group of pricks all put together, and each test is a different item, and you see whether there's an inflamed response from it.
Okay, so that's what we're doing?
No, that's a screening.
Not. Okay.
That's not what we're doing. That's kind of a screening test that a lot of the allergists use.
Okay.
If we really have people with difficult type of allergies, or it's not nearly as apparent, but they say, well, I react to this item, but I may get headaches, I may get shortness of breath, I may get itchy eyes, but the screening tests have not proven to be positive. Then we go to the intradermal testing, which we're going to show you today, which is much more sensitive.
Okay.
And with that, you take a small amount of the allergen, which has been specially prepared in different concentrations. We call them dilutions.
Okay.
So we have dilution 1, which is the strongest, and it goes down to 6, 7, 8, which are the weakest ones.
Oh, okay. That's interesting. As it goes higher, it's...
Well, higher is stronger.
Okay.
Or the less number is stronger. So 1 is the most concentrated. And then as the numbers increase, it becomes more dilute.
Oh, okay. Interesting.
And for those who are scientific, it's 5 times less dilute, or 5 times dilute, or less strong from the prior number.
Oh, okay.
So we take pretty big jumps in it to determine what the sensitivity is. Okay. So we'll be demonstrating doing an allergy test where we will start with 1 strength and then either work stronger or weaker depending upon what the skin response is to that item.
Oh, okay. And we're going to see it done live right now, right?
Exactly.
All right.
So we're going to test dust mite.
Okay.
And dust mites are in your house. Dust mite lives off of flakes of skin, and so the biggest concentration is in your bedroom.
Right.
And so people that are dust mite sensitive really have to clean up their bedroom, wash their sheets frequently. Best to have hard surface floors. Best to have a HEPA type vacuum to keep things clean. And then I think the other test is going to be a mountain cedar, which we just got over with, but is very common here in Texas.
Absolutely. Well, perfect. I just want to quickly introduce, I'm going to take this camera really quickly. We have Valerie helping us out behind the scenes, and then I'm going to give this back to her. We have Renee here, who is going to be doing the testing. Say hello.
Hello, how are you?
And then we also have Mallory, Dr. Johnson's daughter, and kind of someone who handles a lot here at the office.
Hi guys.
All right, so she's agreed to be our beautiful model for this test. So I guess, Dr. Johnson, would you kind of take us through what we're going to be seeing? And Valerie, you might want to take kind of maybe a close-up of what's going on over there so that people can kind of see,
right now,
everything.
I'm going to clean her arm off where I'm going to put the injections. So we have a clean surface that we're working with.
And the injections don't hurt, right?
No, it's like a small bee sting, or if anybody has ever had to have a TB test where they just go up underneath the skin. So it's not it's a small stick.
Okay. Yeah. And Dr. Johnson, tell me a little bit about what's actually happening once the needle goes in, and tell us a little bit about the science behind it.
Well, what is called is an intradermal skin test, where a small amount of the antigen, the actual substance which we're testing, is placed in the layers of skin. It's not subcutaneous, which is below the skin, but it's in the different layers of skin. You make a little bump, which is called a wheal.
Oh, look at that.
And it is measured, and then if it grows 2 millimeters or more, then that's called a positive test. And what we see is that the skin, if you're sensitive to it, will release histamine and other inflammatory factors which cause that response.
I see. Okay. So what did you just inject there first?
This actually is our mite mix, so that's your dust mites, your bed mites, your good stuff that we're playing with. The next one that I'm going to put in is actually the mountain cedar.
Okay.
So in the allergy world, they make the one of the purest items that is made is mite mix. And there's 2 different types of mites that we test, and it's put in a mix just for convenience sake, so that we don't have to test so many different items, but we test it together, and we can see then whether there is a reaction. If it does grow, then we know that the person is sensitive to that. Now, we started with a dilution number 4.
Mm-hmm.
So remember, 1 is the strongest, 4 is 20 times weaker than 1.
Wow. Okay.
So
it's by 5.
It's by 5.
All right, cool.
Now,
Learning a lot here.
then depending upon what her response is, we will either go 1 step stronger or 1 step weaker to confirm that sensitivity.
Okay, so these right here are both the same, or they're different.
They're different
that was
items,
the mic.
but the
Okay.
same. In this case, they happen to be the same strength.
Okay. So we have a question. Let's see. Sarah says, "Very cool. How many do you test?" So what are kind of some of the options? I mean, I see a lot of bottles over there.
Well, there's all kinds of environmental items we can test. There are pollens and molds. There's like 13 different molds that we can test. Then there's trees, grasses, weeds. There are mixes of those, and then there's individual items of those. So you can have up to 10 different items per either tree, grass, or weed, and they vary, of course, across the country. So since I see patients from all over the country, we have what we call regional mixes. So an eastern regional mix will have something different than a western regional mix for trees, grasses, weeds.
Okay. And I don't know if this is kind of a weird question, or I don't know if I should know this, but something like this, is it only for like molds and outdoor pollen and stuff like that, or can it also be used for something like a lactose allergy or celiac or something like that?
The answer is yes.
Sort of.
Well, no, because celiac is due to gluten.
Sure.
And we can test for gluten. We can also test for the individual foods, and grains is what produce gluten. So,
all this easy way.
So yes, so we can test foods, all kinds of different foods, and foods can cause all kinds of different problems. They can cause things like headaches. They can cause, of course, gastrointestinal problems, where you have gas, bloating, nausea. They can cause muscle aches and pains.
Sure.
The headaches, they can cause itchy eyes, runny nose, congestion. Foods can cause asthma. And of course, everybody knows about seafood allergies,
right,
where you can get anaphylactic reactions to it.
So you could actually do a little insertion of like a type of seafood mixture?
We typically don't mix seafood together.
I guess that makes sense.
But yes, there is a manufacturer that does put them together, and you have to be careful in testing that, because you can really create a reaction. So we're always very careful as we test to make sure that we have a good history, that they haven't had anaphylactic reactions. If they have, we're ready to take care of it and treat it.
Yeah, absolutely. So tell me, we're going to talk to you right now, Mallory.
Sure.
How does that feel?
It feels okay. So I know from past experience, and I know now that I get itchy with these. So that's the kind of reaction you'll see. And once you get a close up, you'll be able to see how my skin reacts to it too.
Very cool. But the pricks didn't hurt or anything, right?
Yeah, and they don't really, like she said, it's more like little bitty bee sting. They don't last very long. It's relatively minor. So, but yeah, so we're doing just a couple today, but I know some people come and do a whole bunch at one time just to see about their sensitivities. But for me, I'm just a little itchy right now. That's about it.
Is there any one question that you get asked all the time that people, whenever they're getting this done?
How long is it going to take?
Oh, okay. Well, let's see. So how long does something like this usually take?
Depending upon what Dr. Johnson orders for them to be tested, it's approximately 20 to 30 minutes per test.
Okay.
If I can get the endpoint within 1 to 2 sticks. Other than that, then it just depends on how the patient is reacting.
So every person's completely different in how...
Every person is definitely completely different. So it could take me, if I did one test on one lady, it may only take me 10 minutes. Another one may take me an hour to get to an endpoint. So it just depends on how much they react.
Yeah.
Each wheel is measured after 10 minutes.
Oh, okay. Interesting.
So it'd be 10 minutes between each dilution.
Yeah.
So if they actually wheel or have a response, then there'll be one confirmation test, either stronger or weaker, depending upon what is needed.
Right.
And so that would be 20 minutes between tests. Now, if they do not have systemic type problems or reactions, then we can do more than one item at a time.
Oh, okay.
So you could test 4 or 5 items at a time.
Oh, I see. Well, we don't want to inject you too much. So tell me a little bit again about what we're looking for so that people can kind of keep an eye out. What should we be seeing, and what should we be looking for?
Well, in this case, it has whelped up, formed a wheel that is the size. It has not increased in size, but there's a red flare. So
I was noticing that. I wasn't sure. Was that from the initial injection, or is that just reaction now?
That's from her skin response. So we'll see that people that are quite sensitive will get flares a lot of times before they actually get wheal growth.
Wow.
And that the wheal growth helps us know what our starting treatment dose is to be safe with that individual.
I see.
Because if you get too strong a treatment dose, then you can reproduce the person's symptoms with the treatment injection. So we want to have an optimum dose for a treatment dose. In other words, as strong as possible to produce blocking antibodies, which is the whole purpose of the allergy shots, but not to produce symptoms.
Oh, that's interesting. It's a very fine line, huh?
Yes, and that's why we're very detailed in the testing.
Absolutely. So how long has it been now? I'm looking at my watch here. How long has she been in there for?
We're at 6 minutes now.
6 minutes, okay. And yeah, we're starting to see a little bit of that redness. Is it getting itchy at all?
Yeah, for sure. Yeah. When I've been tested before on this, I knew that this is kind of my reaction. I get itchy, and then I definitely get some growth, but we'll see what happens the next few minutes. But
that's so interesting. And so people who are just joining, I kind of want to give a quick recap. It's our Live with Dr. Johnson, of course, and we are talking about allergy tests, and we are doing one live with the wonderful models we have here, Mallory and Renee. And we have Valerie behind the camera. I'm going to quickly turn around so you can say hi again. She's helping us video so that we can kind of move around and really be able to see everything. So tell us again kind of quickly what's going on here and what kind of test this is.
We're today doing intradermal skin testing, testing for dust mite and mountain cedar. Dust mites are, of course, in your house. living off your skin flakes. They're the little critters. And then the mountain cedar is the pollen.
Okay.
And mountain cedar is over now, but it's in the winter. But a lot of people are sensitive here in Texas.
Sure.
Occurs in December, January, February mainly.
Okay. And so what is the allergy that's most popular right now in the springtime?
Well, in the spring, it's grasses and trees. Now,
okay.
molds are year-round.
Right.
And molds tend to have more of a delayed inflammatory response. We test them exactly the same way.
Right.
It's just for demonstration purposes, and the person we're testing happens to be sensitive to these two items, so we can show you what it looks like.
Right, so we can actually see what's going on. So it's definitely getting a little red there, and feeling the little itch.
Yep, for sure. Yeah. So it'll pretty much stay the same for now. It'll stay itchy as long as we're at this level. So.
So kind of what is the next step here? Once you find out kind of maybe she's a little bit allergic to these things, or let's say, it got huge or something, and what is the next step after that?
Well, this testing determines what her treatment dose is.
Okay.
So once we know that they're sensitive and we determine their treatment dose, then we make up allergy extracts, which is the allergy shots.
Sure.
And then the patient takes allergy shots to help build up their tolerance to the items that they're sensitive to.
And it's all specific to that person?
It's specific for that person, and the treatment doses are specific to that person.
Okay.
Depending upon what the individual item test is. So if they're very sensitive to, say, dust mites, but less sensitive to molds, the treatment dose will be made up accordingly so that they can safely take their treatment dose without experiencing adverse effects, but positive effects in building up tolerance to it.
So once you build up the tolerance to it, then do you start having, do you get shots less and less, or how does that work?
Yes. So you build up tolerance over a period of a year. We can retest at the end of a year to determine what new doses are, or we can just try and push the dose to stronger doses, depending upon how the person responds. Usually allergy shots will take 3 to 5 years to really develop true tolerance to it.
Wow.
And then some people who are really sensitive find that they feel better if they stay on shots on a longer period of time but less frequently.
Sure.
So usually we start every 4 days, work up to once a week, and then if they're doing well, then we stretch it out to once every 2 weeks, maybe once a month.
Right.
I think we're ready for the next.
Oh, excellent. Okay, so what are we doing now?
So she actually is having some response to it. So we're going to go to the next dilution and see what her response is on that next dilution.
Oh, okay. So go ahead. We're going to get to see a live look again at another.
Arm there.
All right. So tell us again, kind of when it goes in. Tell us how it feels, because I think seeing a needle can be a little daunting. I think.
No, yeah, I understand the needle hesitation. So, yeah, it honestly looks more dramatic than it feels, because you have the little bubble from the solution, but it's really just kind of like just a very slight little needle prick, little needle sting, and it's very quick. So
so nothing to be scared of.
No, it's really pretty mild. So the main thing I think you remember is any reaction that you have.
The reaction.
Yeah. So as far as
itchy.
that gets itchy, but that of course that only happens if you're sensitive to something. So in this case, we pick things that I'm sensitive to, so I'm gonna be itchy. So,
So is it itchy? Is it itchy just on the spot, or is it kind of just itchy all over your arm?
For me, it's just itchy in that general area. I know Dr. Johnson can speak more to it, but I know some people have physical symptoms as well as symptoms on their arm or wherever you're doing the test. And different people kind of have to report their symptoms differently. So I don't know a whole lot about that exactly, because that's not my experience. Yeah. So he could probably speak more to that. But.
Yeah, tell us a little bit about what kind of some of the reactions you've seen, and maybe a question or any questions that you get a lot.
Well, the questions, is what happens when I skin test? Mm-hmm. Will I have symptoms? Will I not have symptoms? Skin testing implies that you will get a skin response. Mm-hmm. Now, most of the time, people will not get systemic symptoms.
Right.
But occasionally we have people that you'll put a skin test on them, the skin won't respond, but they'll start to have itchy eyes, runny nose, headache, joint pain, cough.
Right.
And so there are other mediators of reaction beyond just what's in the skin that a person can have causing their symptoms. Now, that may not be a true IgE allergy by medical definition, but it is an allergic reaction.
I see.
And it's very important because we can see then cause and effect relationships. So we'll see that with some foods where people say, well, I know I have problems when I drink milk, mm-hmm. but they really won't have a skin response to it. But if you skin test them with milk, their symptoms are reproduced to what they're complaining about. So that's important and helps confirm generally what the person is telling you.
Okay. Wow. And I know we talked about this a little bit earlier, but for people who are kind of just tuning in, you can do foods, gluten and milk and, dairy and stuff like that too, right? It's not just molds or pollens or...
Right. You can skin test pollens, dust, molds, foods. Then there's some other items that you can skin test, like metals. Some people have trouble with nickel, that type of thing. We skin test titanium for if people want titanium implants or they're having trouble with a plate that may be titanium or stainless steel.
Wow.
We can see what their skin response is to that and help give some guidance in whether they need it taken out or whether they should have another one put in. So that all helps.
Absolutely. Wow. So how often should you get skin tested? And I want to kind of take a look, see if anything's happening here. It's getting a little red again, huh? Mm-hmm. And let's see, we have another question. What does treatment look like for allergies?
Treatment is a vial is made up,
mm-hmm.
and then a certain dose is drawn out of that vial. Looks just kind of like what we did for the skin test.
Okay.
But instead of making a wheel in the skin, a shot is given subcutaneously.
Oh, okay.
So the needle is actually stuck through the skin, and the solution is injected under the skin.
I see. Okay. So then you're building antibodies at that point.
You're building blocking antibodies, which helps build up tolerance, which is the tolerance mechanism.
Wow. Okay. So how often? You said about once a year.
You can retest once a year.
Mm-hmm.
Sometimes if they start to have trouble with their shots, before then we need to figure out which item it is that they're reacting to more.
Yeah.
And trouble with the shots means that when they take a shot, they start to get itchy eyes, runny nose, and it persists. Then you have the wrong dose. And so you got to figure out what is the correct tolerated dose for that individual.
Wow. Okay. So how are you feeling now with the higher dosage? Right? Is that what it is, or what is this?
Lower doses.
Lower doses.
Yes. So still itchy. You can. Some of them, one of them tends to swell up a little bit, and you can see.
I'm going to move actually on this side of you so that Valerie can get in and see kind of.
No worries.
Okay. So what were we saying?
Yeah, so, still itchy. That's kind of my main thing that I notice. I will swell up a little bit, which I have done. And it's gotten pretty red. You can see kind of around my normal skin tone what it looks like. So I'm definitely sensitive to these. So, I haven't personally done any allergy shots in quite a long time, but maybe I should. Who knows?
So, and I know we kind of touched on this, but Dr. Johnson, I'm going to slide back over here again. Can you tell us a little bit about if someone knows they're celiac, or they think they have a gluten allergy? can you inject them, or will they have too bad of a reaction, or will a little bit work? Or tell us a little bit about what you've seen in that regard.
Well, if we know that they're very sensitive, then we start with a much more dilute test.
Okay.
And then we can work up to find out how sensitive they are. With the gluten in particular, we can look genetically with a genetic test, which is a mouse swab, to find out whether they have genes that predispose them to gluten sensitivity or true celiac disease. Because there's genes for true celiac disease versus just the sensitivity part of it.
Right.
So now medicine is it's really neat and exciting because we can look genetically how we're made, as well as what actually our allergic manifestations are, and really help people that are having kind of chronic problems that have not been apparent what the cause and effect relationship is. We can now define that and help them what their diet should be, what they should avoid, whether they need allergy shots, or whether they can just take some medicine to kind of cover up the symptoms during the seasonal discomfort they have.
Right. Wow, that's so interesting. And would something like, would you see a reaction for someone who has a gluten allergy on their skin, or do you think that would be more systematic?
No, we see it on their skin.
Wow.
We can really see it on their skin in most cases. There's some that's not.
Yeah.
That it's mainly just GI, where they'll get some bloating, maybe abdominal cramping, some diarrhea. See it often in kids that complain of belly aches, where they don't truly have celiac disease and they've been tested for that, but they have gluten sensitivity. And so if you do the genetic test for it, you'll find that they actually have those genetics that relate to gluten sensitivity and not the celiac disease. I just want to point out that she's my offspring, but all that allergy came from my wife.
Have you ever had an allergy test on you?
I have, and I'm a little allergic to milk, the dairy.
Oh, okay, interesting. Are you, Mallory, at all allergic to milk? Hold on.
I haven't tested in a long, long time, but I think it was last time I tested, I was at least a little bit, but nothing. That's a huge problem in my day-to-day life, really.
Okay.
So,
how funny. Well, that's interesting. So let's take a look. How long has it been about now?
It's been about 9 minutes. I'm just going to kind of test and see what her wheeling is at. Response. And so she is actually.
So what are you looking for right now?
To see if there's any growth on the circle. If it goes outside the circle where I've made that circle, or it's larger than the 7 millimeter, then it actually is a slight response. And she is still having a response because she's at 9 millimeters here. And this one actually is not responding.
Okay.
So this would be her endpoint, would be a 5/4.
And we have a question here. Does the treatment work for celiac?
It can help with sensitivity. Now, there hadn't been a whole lot of studies done on that.
Oh, okay.
So still, avoidance is the main thing.
Right.
Because most of the symptoms from gluten sensitivity involve GI.
Okay.
And so avoidance is the main thing with it. Now, just so we are clear on the testing we've seen here, she's more sensitive to dust mite than she is to mountain cedar.
And that's the top versus the bottom, right?
Yeah, the top is mite, and so she is on a 5 dilution, and the wheel has grown from, you start with 5 or 5? 7 it has grown from 7 millimeters to 9 millimeters. So the testing is not quite done on dust mite yet.
I see. So you would continue on.
So we'd go to a 6 and see what the 6 does. On the mountain cedar, she did not grow on the 4th dilution, but she did on the 3rd dilution, and so our treatment, our dose is the 4th dilution.
Okay. So how does it feel?
A bug bite or something. So it's kind of the same feeling actually to a mosquito bite or something like that. So it gets warm, gets itchy, it gets raised up. So
I can't stand bug bites, so you're a trooper for dealing with that.
No, it's all right. So So, but by the time the test is done, at least for me, it goes away.
And I think probably a big thing is to be able to figure out what you're allergic to. So worth it for 20, 30 minutes of slight discomfort, right? No, nothing bad. Is there anything else that you think people would really want to know, or any other questions you think people really have with when it comes to allergies and the allergy test, and any questions you get a lot?
Yeah, I think we covered most everything in the whole process.
Right.
Now, if you're going to test molds, trees, grasses, weeds, that's going to take a couple days.
Sure.
Particularly if you're really sensitive.
Okay.
Now,
so she could have like her whole arm filled up trying to find what it is.
Well, you'll have quite a few tests on one arm, and we use both arms.
Okay.
A lot of people will go to the allergist, and they do the traditional prick test, which they do all of them at once, typically on your back.
Oh, okay.
And you may know that you're sensitive. It's not nearly as sensitive as the intradermal testing, and so they will sometimes come back and do some intradermal tests to help
afterwards
define it more astutely and to see what's going on. But if you know you're allergic and you've had negative tests from the prick test, definitely you want to test with the intradermal type technique we described today.
Okay.
To use the more sensitive technique.
Absolutely, to really pinpoint and get a clear view. We have in the top of the comments, we do have your Facebook tagged in there, but how can people reach out to you if they have questions about allergies, about the test, about treatment, anything like that, besides kind of commenting under here and visiting your Facebook page, what can they do?
Well, there's the website,
which
is johnsonmedicalassociates.com.
Perfect.
And there is a question place on there where they can ask questions and get information.
And to make an appointment, how would someone do that? Would they just kind of call in and?
Yeah, they can call the office number, which is 972-479-0400, and it's on the website.
Okay, wonderful. Well, Dr. Johnson, thank you so much. And next week we are doing an asthma test, correct? Possibly.
Okay.
No, possibly. We might try an asthma test, but we'll keep you posted for sure on what we're doing. But Dr. Johnson, thank you so much for joining us.
Thank you.
My
pleasure.
All right. Well, we'll see you in 2 weeks at 1 o'clock on Wednesday again for Live with Dr. Johnson. Bye-bye.